Welcome to SoberSmash. Get to the core issues with King Scott and Dr. Joe and get SoberSmashed.
Welcome to another edition of SoberSmash Live. Today's special guest, Dr. Dari Shapiro. She's a dentist operating right here in Boca Raton and West Palm Beach. And now, to the hostess with the mostest, it is King Scott and Dr. Joe. Hey guys, welcome to the show. We have a great guest today, Dr. Dari Shapiro. She's a rockin' dentist.
Hi, Scott.
And she's really cool. So, I'd like to welcome, here we are. Here's Dari. She's rocking. That's right. She's rocking it in your mouth, I guess. Is that right to say? She's rocking in your mouth?
I guess so.
I guess so. Well, welcome, Dari. It's glad to have you here.
Thank you, Scott.
And I know you see a lot of the clientele at Treatment Partners of America and a lot of other centers. So I guess you're an expert in that field of recovery with dentistry.
Yes, I am.
And I'm sure you've seen a lot.
We have.
We have.
We see a range of people with addictions, and we try to help them along. What are
the signs of an addict, towards dentistry? What do you look for, like the signs?
The signs are, the number one sign, quite honestly, is rampant tooth decay. And when we see this, it's generalized throughout the mouth, almost on every tooth. And we try to help the person. We ask them, we go over medical history, and we try to bring it out for them so that we could get to the bottom line, so we could help repair them.
Okay. Dr. Joe, what do you think of that?
Well, we all know that addicts neglect many areas of their life, and obviously their oral care is part of that. And can you tell me some of the diseases that you might see as a result of neglect of dental care?
Okay. The oral the mouth is usually the last, is our we don't think about it often. And we don't realize that the mouth is the gatekeeper to our body. And if we don't take care of our mouth and the buildup and the bacteria that gets into our mouth and decays our teeth, that's all bacteria, gets into our bloodstream, and it could affect the systems of the body, such as the heart, the brain, diabetes, the blood pressure. It all comes together. So it's very important to take care and get the proper treatment.
If anybody has any questions for Dr. Dari, you can also write in on Facebook and let us know what you're thinking about, and we'll make sure that one of us or Dr. Dari will answer your questions. So just ask away, and we'll get you some answers. I know a big topic is fear. I know when I go to the dentist and I go see you, I have no fear. You're great. But, most people do have a fear of going to a dentist. I don't care how tough you are. The biggest guy will sit there and shake and cry in a chair. Mm-hmm.
Yeah. That's 100% true. And, I hear all the time. Oi.
Wow, I know you get that drill sound happening, right?
And that's why we have headphones for you in the office. But, we have a lot of people come in, and the first thing they say to me is, "I hate you," And my biggest joke is, if I added up all the people that hate me, I'd probably be in a mental institution right now, locked up.
We can treat that here at Treatment Partners of America.
Perfect.
So if you do have an issue,
people hate me.
Come see us.
And I say they hate what I do. They don't hate me, obviously.
Right.
And it is a big fear. We have military men come in all the time, and they're shaking they're shaking. And what are you shaking about? We try to walk them through. No judgment. No judgment. It's a very fearful thing. We have people covered in tattoos, needles.
Right.
But they're scared. They see me and they start to shake.
Yes.
So yes. We really try to help them along and take the fear out of it.
Isn't it true that dentistry has come a long way in the last 20 years where you've found ways to reduce the pain to barely anything,
Absolutely. But I try to stress to people, I try to stress to the patients that if you take proper care all along, you won't get to that point. You know, the fear is keeping them from coming in. So when they do come in, that's what a root canal is. That's when you're here and you're infected and we have to fight, or my anesthetic has to fight your pain and the infection. That's a big deal. You're making us look bad almost. I try to tell that to people. The longer you stay away, the harder it is with anything.
Well, that's the thing. An addict's not thinking about, I want to go get my teeth cleaned tomorrow. I'm worried about, where am I getting my next fix, or where am I going to live, or what's going on in my life. I'm not thinking about, hey, my teeth are starting to look yellow and green.
No, but when they come in and they finally are trying to get their heads clear and they're doing the right thing for themselves, and they come off these kinds of medications that are hurting their heads, and they realize, wow, I'm having pain, and they're having this horrible tooth pain. How could you help yourself? How could you think when you have this pain? Patients come in all the time, just take this tooth out, I can't take it anymore, I've been up for weeks and months, and this, that, and the other thing, and I'm like, please, let me just take the nerve out, let me just get you out.
So basically you have to educate them at that point.
Yes.
That's what it is, because people think, I have pain, get rid of it, I'm done, just pull it out and I'll deal with it.
100%.
And it's not the right way to look at it, I would think.
It's not the right way to look at it.
So your job is to basically educate them, show them what you can do and how to maintain the rest of their mouth.
Absolutely.
So they don't lose all their teeth.
Absolutely. And you know what? You have a lot of cavities in the front of the teeth, and you're down on yourself a little bit, and you're trying to get better. When you look in the mirror and you put on it and you look and you smile and you see some pretty white teeth where before they were brown, it can make a very big difference in the overall persona.
Absolutely. Right. Absolutely.
Now, someone brand new in recovery, they're trying to do the right thing, they got a job. I know it may sound obvious, but what would be some good dental care for that person to start taking care of their teeth in early recovery?
The first thing to do is brush and floss. Look in. If you're brushing your teeth every day and you're bleeding, that's not normal.
Yes.
Okay? And people, forget about patients, people get scared. Oh my gosh, I'm bleeding. You're bleeding for a reason. The more you bleed, the more you brush. You're asking for help. Your own mouth is asking for help.
Yes.
It's telling you. So the first thing I would think of is, if you're feeling uncomfortable in any way in the mouth, you can't focus on yourself without making sure your whole body. If you had a broken arm, you're not going to walk around with your arm broken all the time. Right. It hurts. You can't concentrate. So you need to fix what's.
What is it about drug use specifically that really screws up your teeth?
Drug use specifically. Okay, well, smoke. Boom, right to the gums, right? Right to the gums. You're right to the teeth. You're constantly putting this chemical on your teeth. It is going to eat things away. But I think.
What about drugs like heroin and meth?
Heroin and meth, I think it's ultimately not just, it's the body system.
Because I've seen some photos that looks like a horror movie.
It does look like a horror movie.
with the mouth.
Yeah, crack and meth are really
Have you seen patients this way? Where
I have, and it's very sad. And what it is it's not just you're in your addiction, and that's all you care about. And the teeth are the last thing. Right. You're not thinking about brushing your teeth.
Right.
You're not thinking about food. You're just thinking about the next fix.
Right.
You leave your teeth are done. You leave them to go. So if you're eating whatever you're eating, the saliva, okay. So a lot of these drugs, you have dry mouth. Saliva is your body's natural way of rinsing the mouth, if you will. And with dry mouth, there's no saliva. The decay is going to run rampant. The cavities,
What about a lot of addicts stop smoking, they switch to vapor. How do you see that effect in the mouth?
Same. It's the same thing.
So the vapor is the same deal. It can't be good for you.
No, it's a delay. Any kind of smoke, anything that enters, any kind of chemical that's into your body will delay the healing process. End of story. It could cause, people bleed out with the heart problems and the bacteria. It's not. Regardless, vaping or nothing.
And what about an alcoholic's mouth? Is that different from a drug addict's mouth?
An alcoholic's mouth, sometimes yes. Sometimes yes. Maybe because the alcoholics want to cover up, and they tend to brush a little bit better. They want to cover up the smell of the alcohol, so they'll maybe be over care. But in that respect, overcare is also, they're constantly brushing and they're constantly, so you're wiping away the enamel. It goes enamel, dent, and nerve. You're getting rid of the first layer.
Right.
So, yes, there's
I know.
different.
Yeah, I know. When an active addict has a toothache, what do? They do more drugs.
Right.
To get rid of the pain, only causing more damage.
Right.
Yeah.
Probably does for that moment.
Yeah.
Probably
Takes away the
feels
pain.
good.
Sure.
Probably feels
Yeah.
good for a few minutes. But that's not the solution. Obviously, it's just not the solution. So I think the bottom line is take care of your mouth, brush your teeth, floss.
Listen, we could
Go see Dr. Dari.
Go see Dr.
Twice
Dari.
a year.
Yes.
Walk in, be smiley, happy. She's not going to bite you
I'm not going to bite you.
unless you want her to. Then she can.
So
That happens.
Dr. Dari, how is your practice different than hundreds of other dental offices? What would be more attractive about going to your practice?
I would say the no judgment.
Okay.
The no judgment. We're easy. We get along. I'm not the regular clinical doctor. I like to have a good time. I like to enjoy what I'm doing, and I like to put people at rest. I do have a psychology background. I try to help. I really do care. Dentists, I think, these day and age have a bad, it's all about the white Hollywood smile teeth, and we forget that it's not just about the front 6 teeth, and the front smile. It's the overall health, and our offices in particularly, we have a very spa-like feel. It's not clinical. We try to help the patient along, and that's what I think makes us different. And we'll go out of our way if we know that it's tough. We know financially it's tough, and we will put as much effort into it to help you as possible.
Right. Beautiful. I know some dentists you go to and they shame you for neglecting your teeth, and you already feel bad and you leave there feeling worse. So it's nice to no judgment. I like that term you use.
100%.
So that people can feel comfortable going in there and not going to be
Yeah,
judged.
some doctors do that to you.
Yeah.
I went to a doctor 2 weeks ago. I had a cold, and he started screaming at me. Like, why didn't you call me a week ago?
Yeah.
And come in here. I
Yeah.
didn't feel this bad a week ago.
You're right, exactly.
I had to feel really bad to come see you.
Yeah.
And that's why I'm here right
Yeah.
now. So
Yes.
shut up and take care of me.
Right,
That's
exactly.
it.
Exactly.
Yes, you feel bad enough. You
I
don't
felt
need
terrible
some-
when I left
Yes,
there. I was
sure.
like, wow, I should have really called that guy last week because he started screaming at me.
You should have
And
predicted that.
the funny thing about it was, he was coughing worse than I was.
You should
He's
have
a
done
doctor.
it. What are you coughing for?
So I said to him, I think you need to go see a doctor. Have you called yet? He's like, you're a really funny guy.
Oh, God, yes.
Unbelievable, something.
But it's nice to feel safe and secure and non-judged. And addicts have been judged, let's face it, throughout their addiction. They're judged by everybody, law enforcement, parents, and friends. And the last thing they want is more shame,
No.
And that's...
No.
Dr. Dari, let me ask you a question. For the addict that's coming to see you, tell me about using mouthwash. What can they use? What can't they use? The benefits, the ingredients they need to stay away from, even whitening products.
There are certain chemicals, and there are certain things in these different the mouthwashes and the toothpaste and so forth that could be extra abrasive. If not, some of the mouthwashes have alcohol in them, so we
Right.
got to be careful in what we're prescribing for each patient. And what type of abrasiveness each toothpaste, for instance, would be prescribed for them. So yeah, that's something to consider. That's definitely something to consider.
So really look at the ingredients in the mouthwash, make sure there is no alcohol.
Absolutely. And we're dentists, and we do a thorough medical history, and we understand that you're self-conscious, but we need to know. We do procedures. If you have a history of certain kind of cocaine use, that speeds up the metabolism, that speeds up everything, the heart. If we go and we're doing an extraction, we use epinephrine, things could happen. We use medicine that affects the whole body. We need to know about the whole.
And what about an addict in recovery getting dental care? Are you careful about prescribing narcotics?
100%. 100%. We try to get them through. We take it slow. We take it easy. We do the less aggressive treatment we can, because we know you're in treatment, and we don't want to add to your discomfort. We want to take away from the discomfort. So we set a protocol with the nurses and so forth, and we try to help them along.
What about, I saw this the last few years. A lot of dentists were overprescribing opiates, for the clients that would walk in the door, and you and I had spoke about this previously years ago even.
Yeah, they dentist shop for pain.
They were doing that. Have you seen that? Or you have patients come in seeking?
Absolutely. I have to admit that it's been a few years that we've had this problem, and one of the reasons
you think that's because the pill mills were shut down?
I was just about to say one of the reasons is because the pill mills are being shut down,
right?
And because everything is so connected now.
So where can I go? Like where's the easiest target I can hit? And they probably say dentists.
Absolutely. But now, first of all, when somebody we know when a patient comes in and they have a certain kind of tooth and they're screaming and yelling, it hurts.
Right.
And we know they've had a root canal already.
Right.
We know.
Yeah.
We know what's going on.
Yes.
So in these cases, we could usually weed them out. But if just in case it gets through, they have a great pharmacy. The pharmacies these days, they're all so interlocked that I have gotten many phone calls about certain people about getting certain prescriptions, and they will not fill the prescription.
Yes.
Sure.
So we do. The good part is that we do have people out there monitoring
Yes.
and supporting the doctors, because we don't know.
Yeah.
They come in as no insurance patients, but they might have insurance at a different office.
Yeah.
Okay, we're going to take a short break, and we're going to come right back with Dr. Dari Shapiro.
Welcome to SoberSmash. SoberSmash. Get to the core issues with King Scott and Dr. Joe and get SoberSmashed.
Welcome to Treatment Partners of America, your partner in recovery. Treatment Partners of America is a unique, state-of-the-art substance abuse facility. Our trained professionals first focus on finding the core issues in trauma that lead to addiction, with some of the best doctors, nurses, and behavioral health techs the industry has to offer. We offer personalized one-on-one therapy 5 days a week, raising the bar to a higher level of standards. Whether it's drugs, alcohol, eating disorders, gambling, sex and love addiction, or even relationship addiction, Treatment Partners of America has specialists to treat and to help heal your addiction long-term rather than attempt a temporary 30-day quick fix.
Welcome back to SoberSmash. Today's guest is Dr. Dari Shapiro, dentist in the Boca Raton, West Palm Beach area. And we are talking about drug use, alcohol use, and the recovering addict with dentistry. And we're taking questions live on Facebook, so feel free to write in, and Dr. Dari will do her best to answer the questions. We have a question here from Sandy K. Is there any harm in starting antibiotics prior to seeing you in the office?
That's a great question. Why are you starting these antibiotics? I mean, for what purpose? Are you a doctor? I have a lot of patients that self-medicate themselves. Antibiotics are masking the problem. They will not cure the problem for dentistry. Right. So if you start taking those antibiotics,
well, maybe somebody's on it. Let's say they have a cold.
Okay.
They have the flu or whatever, but they have a toothache now.
Okay.
So they want to come in and see you.
Okay. Well, if they're taking antibiotics, there's all different types of antibiotics that direct certain systems. So what you're taking for a cold may not be working for the dental. It might be coincident. Oh well, it stopped hurting. Well, I promise you, it's going to come back full force. I promise you. So I would rather you not just start taking antibiotics and medicate yourself without seeing us first.
What about that person that's like the hypochondriac? Like, oh, I got a pain. I got to run to the dentist today. This is hurting here. This is hurting here, and my elbow hurts.
I love them.
I mean, you get a lot of that.
Of course.
You know?
Who doesn't love them? You know what? All kidding aside, it's better to be safe than sorry. And those patients, you know what? Feel free to come in. I'd rather find something small than something big later. Absolutely.
Early detection in dental work is just like anything else, right? Early you catch it.
You know, just like anything else. You know, people say, well, it hurts. Well, it's expensive. Well, it's this, that. You know, paying a little bit of money for a cleaning a year is, or twice a year is a lot less expensive than doing a root canal, crown, implants, whatever else is needed.
Got a question here from Johnny B. How about MRSA? Do you find this a big issue with dentistry?
No, MRSA's in hospitals. Okay, it's a good question. I've personally never seen it in my office. Clean. That's another thing. If you go to a dentist office and they're not OSHA regulated and that place isn't perfectly clean, I would run. Yeah. That's me.
Right.
You know, it's very important.
So if you walk in the office and they're cooking barbecue in the examine room and they have a little grill in there, probably get out.
I think you might want to switch your
probably not the right place
office.
to go to.
Absolutely.
Got some ribs cooking, some burgers, and not the place to go.
No.
With the smoke.
No. But yes, cleanliness of the dentist. You're smart enough to look down and see what's going on.
So I read about a year ago that the state of Florida was one of the last states to finally regulate the coordination of pharmacies. So have you noticed a difference in the last few years about the connectivity between pharmacies?
I do.
Yeah.
I do. I do. I think there's a lot of less drug-seeking behavior, at least with dentists. It could be our offices. We're very strict. There's no reason why dentists should be handing out lots and lots of pain pills, especially on one patient. There is no reason. At that point, if I find that we treatment planned a patient and they got antibiotics and pain medication and then came back 3 months later and they never had the problem, I'm going to say to them, I'll give you a couple, but you got to treat the problem.
Right,
We're
yes.
done.
Yeah. Yes, I know active addicts, when they have a tooth, say, needing a root canal, they don't really want to get that root canal. They want to go get the medicine and say, oh, I'll come back. I'll make an appointment for the root canal, and you never see them again because they want to use that tooth as a way to get drugs.
100%. And that's why we have to rely on the good doctors and, good people to do the right thing.
What's some good tips about dental care? Not the old ones like no candy, no sticky candy, stop eating all the sweets. What has changed in the last 10 years that you're looking at differently, saying, avoid this now? Not just the candies. Like, stay away from this.
Avoid this now, not just the candies. You know what? I think that's a great question. I'm thinking, you know what? What are those power juices, those power aids?
Yes. Gatorade, Powerade.
So much
the
sugar.
Powerade. It is all sugar. Yes. The juices, we even tell our kids, have some apple juice, instead.
Right.
No, this is sugar-coated water.
Right, yeah.
And the best thing for you is water. End of story. Yes. These Gatorades and Powerades, people who are working out, they're thinking they're getting these extra nutrients, but what they're doing is just adding
it's all
sugar.
the electrolytes, when you're running. I'm sure, Dr. Joe, you run marathons, right?
Yes, yeah, sure.
Do you drink them?
Yes. Well, I drink them during the race. I don't drink them any other time because my body's going to eat that sugar immediately. But other than that, I don't touch Gatorade, Powerade, or anything like that. And I don't even touch the sugar-free drinks because there's things about Splenda that are on the web that aren't so great.
Chemicals. That's
yes,
it. Chemicals.
That's it.
You want all natural.
Yes. Right.
All natural. Okay? Energy drinks, rot teeth.
Yeah.
The more you drink a day, there you go.
As Jay swishes his Red Bull.
Mm-hmm. Mm-hmm.
You got to stop drinking that, Jay. Sorry.
Sorry.
Good for you.
Brush and floss.
Now, I know another topic about dentistry that's always out in front is the cost.
The cost.
So here I am, new in recovery. I got a little job. I'm a waitress or a waiter or a tech in a treatment center. I certainly can't afford some of the dental procedures. Does your office, do you help people with payment plans or whatever? I mean, what can you do for that new addict who says, I can't afford dental care right now?
We will do whatever we can to help you out. Good. Even if it's something, look, if somebody comes in and they have a whole mouth problem, it didn't happen overnight. It's not going to be cured overnight. Right. It is our job to help you. Yes. We will do whatever we can. We're not, we're in it to help people. Yes, there's money attached, granted. But we're in it to help people. So whatever we could do, we could put on payment plans.
Beautiful.
We have an in-house insurance that could, a discounted insurance. And we'll do something.
Okay.
Just getting through the door. You could do it. Get rid of the fear. There is no judgment. Don't judge yourselves. What's done is done. Let's just get you clean and overall, so your head and mind can focus.
How did the Obamacare coverage fall into dentistry? How did that work?
Okay, that's a very interesting question and a very loaded question, but I'll try to give a basic. When people don't have insurance, they don't go to the dentist. And years ago, dentistry, like I was talking about Hollywood Smiles, was cosmetic. Everything was cosmetic. Let's go, let's go, let's go. Well, I do believe, at least in my offices, that because of the Obamacare and people scrambling for insurance, everybody was scared. And so it became emergency. It became emergency dentistry because exactly what you're talking about. They waited, and they can't pay. Yes. They didn't have the money. I don't have insurance. Yes. Well, like I was saying before, you might not have insurance, but dental insurance is not like medical insurance. Dental insurance, we're discounted. I think that's a myth. I think that's people come in, my insurance covers everything. I'm sorry, it doesn't. Yes. It's not our fault. Don't shoot the messenger. And with Obamacare, people assume, well, I pay for this. It's going to cover everything. Right. It covers preventative. Yes. That's it. Yes. Okay? Right. And just like Medicaid, that's the same thing. Preventative. They're not going to cover bleaching. They're not going to cover braces. They're not going to cover crowns and veneers. They may cover an extraction, but we're trying to get away from the extraction. You need your teeth. Right. Okay, that's where you're going. If you get a tooth extraction and then you want it restored later in life when you have some kind of substance, that's where the money is. Right. That's where you're placing the money. Sure. So again, it goes back to preventative. Let's get you in there. Let's take care of what we could take care of so these big problems don't come about.
Yeah. All right, we got another question here from Facebook from Susan B. How much toothbrushing is too much, and when does it become dangerous OCD?
When you're asking if it's going to be dangerous OCD. 3 times a day after meals, brushing and flossing would be great. Light brushing, don't kill it. If you're going to scrub those teeth, I'm not going to go to the dentist. I don't have money for the dentist. And I'm scrubbing. You're scrubbing the layer away. 3 layers, enamel, dent, and nerve. You scrub that enamel away, it's gone for life. The only thing that can replace this is a restoration.
So 6, 7, 8, 9 times is too much a day.
A little bit excessive.
Okay.
A little bit. Love you, but a little bit excessive.
Gotcha. Keep it to 3.
Keep it to 3.
So you mentioned you have an in-house dental plan. Is that a discounted plan where you pay for the plan through your office and your services are discounted?
That's exactly what it is. Okay. I found with the Obamacare, actually, that because people were dropped from insurance plans, they didn't have the dental plan. So they weren't coming in, and it was emergency medicine. And I needed to do something to get these people back in the office. Well, like I said before, dental insurance does not cover anything. It's a discounted plan. You are going to pay out of pocket. I promise you, there's nobody out there that has 100% benefit. So by giving this is a little extra help. Okay, a little extra help. You get a couple cleanings a year for a discounted price. You get a percentage off usual and customary fees. Whatever we could do to help you, that we could all benefit from, a mutualistic relationship.
Sure,
Look, if you're going to take the in-house plan, then I know that you're serious. I'll do what I can to help you.
You know, why do they separate dental insurance from regular health insurance? It should really be combined.
I would think it
You would
should
think
be.
It would
Yes.
be. It would make life easier for the patient and for the doctors that they go visit.
That's
Keep it
true.
all as one.
That's true. That's true.
Sure.
That's true. I have no answer for that, but that's a
Right.
good,
Just
good
a
question.
Thought. Just a thought.
Yeah, but like you said, dental insurance today is a discount plan. Is
That's
all
it.
is. You'll get some. I know mine has a $1,500 max. So
And that's a good one.
so once
Yeah,
it
that's
covers
one of the best. Once
1,500,
you're
that's
done.
yeah, that's about it. Yeah.
You know, people who need that, but that also helps too. You know, $1,500 is $1,500.
That's right.
So you
Yes.
know, you might be one of those people that fall under. You get a couple fillings a year, cleaning it covers it for
Right,
you.
yeah.
You know, so it's good. It's good.
Or if you don't wait for 5 years and let them all add up,
Right.
then you go in and get everything pulled out.
You snooze,
It
you
won't
lose.
cost you-
Every year
Right,
starts
yes.
over.
All right, we're going to take another short break, and we'll be right back with Dr. Dari Shapiro. Stand by.
Welcome to Treatment Partners of America.
For me, seeing a client enter and then go through the whole program and graduate is the most rewarding feeling one could ever have.
Clients need physical, social, spiritual, mental, and intellectual knowledge.
I get to see the miracle and the change within a client from the time that they come in till the time they discharge.
We are Treatment Partners of America.
Your partner in recovery.
Welcome back to SoberSmash. Today's guest is Dr. Dari Shapiro, dentist extraordinaire from Boca Raton, West Palm Beach area. She's a dentist to the stars and also everyone in recovery. She's the one to see. Dr. Dari, tell us why you're so different, why your office is so different. And I've been there, and I can say it's definitely a different feeling walking in the door. It's a very zen atmosphere.
Purposely.
I feel chill, laid back. I listen to music. And I walk out of there and I feel good.
I love it.
And I'm still dressed.
There you go.
It's good. It's even better. It's all good.
We try. You know what? I feel calm in a spa like setting. I just when I go to Colorado and you see the mountains and the rocks. That's what our office is about. We from the minute you enter to the back. The people, we enjoy what we're doing. We care about what we're doing. We care about the patient. I care about your overall health. When I tell you something you don't like, I'm sorry, but it is what it is. Don't shoot the messenger. We just try to make you feel comfortable from the minute you walk into that office to the minute you walk out. My staff is well equipped. We know what we're doing.
Now, you work with your husband also. He's a dentist.
I do work with my husband.
How is that?
Fabulous.
Dr. Seth.
Fabulous. We love Dr. Seth.
Shout out to you, Dr. Seth.
Hi, Dr. Seth. We met in dental school, first day in dental school, and it was great ever since.
Wow.
Wow.
Good for you.
I have to say, I actually enjoy working with them.
That's great. That's
So,
great.
It's family dentistry, and when you walk into those doors, you're part of our family, and that's the bottom line.
Well, I think that's what's so important about going to a dentist in general. You need to feel comfortable walking in that door. You need to feel secure. It's all the fear, and you need to leave it outside.
Right.
Walk in
Most
and
people
say,
are
"Listen,
nervous anyway going to
this is
dentist.
going to be a great experience. It's not a weird experience. You're walking in, you're getting what you need done, and you're going to feel good when you leave." And I think at the end of the day, that's what everybody wants to feel like.
And that's what you should be like with all your doctors. You need to have a bond. You need to trust. You need to trust each other. If it's not there, it's not there. Dentists sometimes get a bad rap, but I promise you, most of us are there to do the right thing and to get you healthy, and that's just the bottom line. And we'll do anything for you. As much as we can, we'll do for you.
And how do people reach you that are listening to this, Dari? When do you let us know how they can contact you and make an appointment if they want to come see you?
Well, you can look up online, ShapiroFamilyDentistry.com, or our office in Boca is called BeaconSquareFamilyDentistry.com. Our phone number is 561-998-0901 in Boca Raton, 561-684-2282 in West Palm, and just tell the front, tell where you hurt us, and they'll get you in right away. We're good like that. We're not, you're in pain, we got you. We follow you through, and to be quite honest, we check on you after.
And we'll also post your information on our site with a link, so you can find Shapiro Family Dentistry. And I can tell you one thing: they know how to treat someone that's in recovery, and that's what's important. Finding the right dentist, not going to prescribe drugs to you just because they know what you need and they know how to handle it and make you feel better.
Absolutely, absolutely, and we'll help you with it however we can. Absolutely.
Absolutely.
So you're in Boca some days, West Palm others? What's your schedule like?
I'm in Boca some days and West Palm others, yes.
Okay.
My husband and I go back and forth between the two offices. We each have our own little niche of dentistry we like to, we enjoy. My husband does a lot of surgery and implants.
Okay.
We do orthodontics, cosmetics, and, the root canals and extractions we split.
Okay.
So
Split them.
we split them.
You take this one, I'll take that.
That's it.
Yeah.
Depends what kind of mood you're in.
Yes, depending on the mood.
Depends what the mood is.
If it's a root canal kind of day, you'll volunteer for them. Right?
Exactly.
Exactly.
Just try not to come see me at 5:30 on a Friday, and I'm cool.
Ooh, yes. I wouldn't go
That's
see anybody Friday at 5 o'clock, 4:30.
No, you never want to go to the dentist when their hours are till 5 and you want to go at 5 to 5.
No.
No.
Probably the worst time to go.
No. Yes.
No.
Probably the worst time. Well, we want to thank you for being a guest today. You were great, very informative. If anyone has any other questions, you can always write in, and we'll make sure Dr. Dari gets them. Look for the link, and thanks again to
Thank you.
Shapiro Family Dentistry for being
Thank
here.
you.
You've been
Thank you.
SoberSmashed.
Nice.